So for the next blood abnormality, blood vessel, defect or abnormality which you'll be looking at is what is known as a DVT. This is a deep vein thrombosis. Alright, so for the deep vein thrombosis, let me just give you guys a brief gist about this before we go in. You just have to do it normally. Your blood should be flowing. Blood should clot only when there is wound on the outside. Do you understand? But if you have blood clotting right inside the blood vessels, it can block the passageways for other blood. Do you understand? So this can actually cause like a backlog of blood in the body. Alright, so it's just a serious condition. This is where blood clots, that's thrombus, is forming in a deep vein. Alright, mostly it's commonly in the legs. Alright, but it can also occur in the arms. Right, it can also occur in other areas. You can see how the veins are basically becoming so weak and dilated, because there's so much work going on. Alright, the blood that is not clotting is trying to overcome the blood that has clotted. Do you understand? So a lot of war is going on. So key symptoms is you have swelling in the part of the body, mostly the arm or leg, pain or tenderness often starting in the calf, warmth over the affected area, skin discoloration. So can you see that the skin of this person, can you see how it is becoming so dark? So right, so it might bring up different colors, red, blue, purple. Right, then the veins are showing on the surface. Okay, so causes and risk factors is this: if you are staying in one place for a very long time without moving around, like had a long flight, or you rested in bed for too long. Right, surgeries or trauma to veins, pregnancy, obesity, smoking, cancer, or you receive chemotherapy, inherited clotting disorders, hormonal therapy, COVID-19, other infections. Diagnosis is all those scanning, MRI, ultrasound, venography, blood test, and all of that. So treatment is basically, if I'm having clots in here, I'll try to be giving drugs that maybe can break down the clots. Alright, then I can also be giving drugs that can prevent clots. Do you understand? So anticoagulants, those ones, this one will prevent clots. Thrombolytics, those ones, there's already a clot, so they are trying to break down the clots. Then compression stockings, surgeries, and all of that. So intravenous catheter filter and all of that. So that's just what the concept of DVT simply means.